Welcome back to the High Impact Medicine podcast. High Impact Medicine is a community of medical students and doctors hoping to lead impactful and meaningful careers. This podcast chats to medical doctors pursuing diverse career paths, ranging from public health, entrepreneurship, humanitarian medicine, and so much more. I hope to leave you inspired and informed from our discussions. As medical students, we want to do the most good, but are not always sure where to start. I'm your new host, Kujani, and I'm a fourth-year medical student from the University of Cambridge, and will be continuing Tanya's fantastic work. Today's guest is a healthcare entrepreneur from India, the CEO and co-founder of Saath Health, an impact-focused digital health company that works with healthcare organizations across the globe to deploy personalized digital health solutions. Its family intervention, launched earlier in 2022, is now reaching 8 million users with credible content on chronic diseases, emotional well-being, and infectious disease. He is also the author of A Glass Half Full, Stirring Healthcare Conversations for a Better Future.
Thank you very much, Kujani. It's wonderful to be here, and thanks for having me.
Let's start by creating a bit of a map of your career for our listeners. What has been your journey from medical school to where you are today?
Well, it seems like a long time back, Kujani. I joined medical school a long time back at the age of 17. I graduated in medicine from a premium institution in Mumbai. I did my post-graduation in medical pharmacology, and I very quickly went to work for the pharmaceutical industry for reasons that we can get into later. But I essentially spent about 12 years working in the pharmaceutical industry with some really excellent companies doing clinical research and development on new medicines across multiple therapeutic areas, working in India, Asia, and many countries around the world. And then about 12 years back, I made a conscious decision to move into healthcare entrepreneurship with a special focus on digital health. And that's what I've been doing for the last 12 years or so now. Saath Health is our third company. We started in 2019, and I think I can say that I'm still learning new things every day. Uh, and that's what excites me about going to work every day, the opportunity to learn new things on a daily basis.
When you think back to medical school, what factors led you to pursue a career in the pharmaceutical industry and not in clinical medicine?
Yeah, so I don't know about other countries, but in India, you start medical school if you're a decent student fairly early. So I started in medical school at the age of 17, which means by the age of 15, 16, you're already sort of mentally committed to pursuing that as a career. And I didn't have the language for this then. I do have the language for it now. I was a reasonably good student, but I felt like at that point medicine was limiting for me, at least the way it was practiced. I was craving at that age for more exposure, for an understanding of how I could apply my clinical and medical skills in a much wider context on a much wider canvas. And that's really the reason why I opted to move into the pharmaceutical industry. Now, all of this I know now in hindsight. At that point, as a young doctor, uh, I think the reason I didn't move into the pharmaceutical industry. I really moved away from clinical medicine is because I just wanted a much wider exposure than I was getting at that time. So I know this now. I did really know it then, but I felt it at some level.
When did you start thinking about doing good and having this wider impact? When did it start becoming more of a conscious decision?
So I think anybody who's pursuing medicine by default is trained to or attuned to the notion of doing good. I don't think anybody I went to medical school with or anybody who's listening to this podcast hasn't thought about doing good. So I think it's a part of who we are. Thinking about a wider impact is really something that I started to think about when I was in my first job working in the pharmaceutical industry. I was extremely fortunate that my job brought me into contact with some outstanding physicians from around the world who not only were the great physicians, they were great statisticians, they were great business thinkers, and they blended all of that with a very laser sharp focus on having an impact on human life, right? So I was extremely fortunate that when I started working with them, I learned about the application of clinical medicine and research on a much wider population, the impact that it can have, and more importantly, acquired the language to be able uh, to articulate what I wanted to do. So I think some of it I started to feel in my industry career, and then I started to nurture my own notions of what impact could be uh, towards the end of my first decade as an employee in the pharmaceutical industry. That's just a couple of years before I started and made the decision to move into entrepreneurship. And again, I was extremely fortunate that I had colleagues and I had bosses who encouraged me to think out of box and to encourage me to think about what I wanted to do. Uh, and honestly, again, when I made the switch to entrepreneurship, it was just with the intention of exploring other things that I wanted to do. I wasn't clear. And the word entrepreneurship is a lot more trendy now. Uh, it wasn't so commonly used in 2008 when I started thinking about it. Uh, it wasn't so cool to be an entrepreneur at that time, at least in India. Uh, but I had supervisors and bosses who really encouraged me to think about the wider impact that I wanted to have. And that's sort of when I started to move towards digital health.
So, would you say that having mentorship and having colleagues that were aligned along similar goals and career paths influenced your own?
Undoubtedly. I mean, when I meet with young students now who are looking for jobs, the thing I ask them to focus on the most, more than the amount of money they'll make, is who are they going to work with? Are they going to end up working with people that are going to inspire them, that are going to help them think through their career goals? And if so, I would say, 20, 30% lower salary is very well worth it. I had some excellent and outstanding mentors, colleagues, friends that I started off my career with. I consider myself extremely fortunate that they gave me the space to explore what I wanted to do, but they also gave me the direction to sharpen my skills very, very efficiently. So I think that is a big, big part of where I am. I'm still very much in touch with all of my mentors, my supervisors over the last 25 years. Some of them are guiding me even now. Uh, but I think it's a big part of the journey that you are on. You need to surround yourself with people that will inspire you. They don't have to agree with everything you say, uh, but they have to make you. They have to be able to show you the mirror and not judge you and just help you along in your career. So I think it's a huge part of what young students should be looking for from their associations.
Moving on to a bit more about what Saath Health is. How did you go about identifying digital healthcare as the cause area you were going to tackle?
Yeah, so again, I think to be able to say that, I can't say that in 2009 I identified digital health as the big shift. I can drop it from my thinking. Uh, so when I was in my second job, we were doing research and development on some really exciting new compounds uh, in infectious diseases, in immunology, and cardiovascular diseases. And one of the things that we started to think was that uh, you know, for any of these therapeutic areas, let's say take an example of HIV/AIDS. At that point, the drugs that are required to treat HIV/AIDS patients as a chronic disease, they already existed. And I'm talking about 2008, 2009, right? So if you had HIV, if you were HIV positive, there were enough drugs out there to make sure that you could live with it like a chronic disease for the rest of your life. But despite that, there were about 2 million people that were dying of HIV in 2008, 2009 every year. And what we realized is that even if the medicines exist, there is a need for us to bridge the gap between the physician and the medicine and the patients to where they are. And that is the gap that can be bridged using digital technologies. So I think there's a couple of pieces that really helped us move in this direction. One was that the way medicine is practiced has to evolve substantially. It has to become more consumer centric, which is already beginning to happen. Uh, Very often and for too long, medicine has been practiced in this top down, I'll tell you what's good for you style. And more and more patients and health consumers are increasingly saying, no, I want to be part of that decision. I want to understand what you're doing. Some of it is not good, a lot of my doctor friends don't like that. But in general, I think it's more in the right direction that consumers are more empowered. So our thinking was if consumers are in any case more empowered, how can we meaningfully empower them to be able to participate in their own decision making. And the easiest tool to do that is to use digital platforms that were becoming more and more common around 2009, 2010. And since then, in the last 12, 13 years, we know that consumers around the world have dramatically increased their adoption of digital platforms. So we think this is a general move for good. There are some cons that come with this move, but in general, more empowered consumers, more educated consumers, more informed consumers wanting to participate in their own decision making is a step in the right direction. And we think digital channels can be used to really improve outcomes and really also lower the burden on healthcare professionals, right? Because there's no country in the world that has enough doctors and nurses to address the needs of its population. So how can you start making, in some ways, you want to make consumers part of the supply side, right? By making it easy for them to invest in preventive health, both primary and secondary. So that is the real thesis of how I moved into digital health.
So it seems that your thinking started with wanting to create a shift in how we deliver healthcare, a shift from a paternalistic delivery system to much more of a partnership between patients and doctors, and involving patients in the consumption of information, understanding that information to help them make more informed choices about their health. Can you tell us a little bit more about what Saath Health does?
Yes, so Saath Health was incorporated in 2019 based on much of the work that we've done before that. So we spent quite some time building digital platforms for HIV/AIDS patients, and then I spent a lot of time working in large public-private partnerships, building digital platforms for maternal and children's health. And through both of these really influential experiences, what we learned is that it's possible for us to use digital platforms to reach beneficiaries and consumers, educate them, generate awareness, and then guide them towards the right health seeking behaviors. And so we set up Saath Health, incorporated Saath Health in 2019, and our vision is to work on the demand side of the healthcare equation, which is reach health consumers where they are with behavior change content across therapeutic areas and indications. Use whatever digital channels are available to reach those populations. So if you're working in rural populations, perhaps you can't get through to the end consumer, but you can get through much more efficiently to an influencer in the village or the healthcare worker. But in large urban populations around the world, it's very easy to get to end consumers directly, right? So our mission at Startup is how do you get to end consumers, educate them, raise awareness around health issues, and then guide them towards health-seeking behavior and health products and services from supply-side partners. We've done this now for about 5 years. Over the last 5 years, we've reached more than 50 million consumers with our behavior change content in multiple languages. We've tried to make the content interesting, entertaining, aspirational, positive. Too often, healthcare messaging is extremely morbid, uh, and I think there is a space to make it interesting and use storytelling format. So we do a lot of that. We have some really interesting, creative guys, who work with us on the healthcare content side. Uh, and yeah, we're very happy that we worked across many, many different applications, doing some really exciting work with youth mental health in Central Asia. We've done maternal and child health in India and Southeast Asia. We've worked across non-communicable diseases in India. So our approach is indication agnostic, it's geography agnostic, but anybody who wants to reach a consumer, talk to them, educate them, raise awareness, and then guide them towards the right health seeking behaviors. We partner with all such people.
So, is the next step then pointing them towards relevant healthcare services?
Yeah, I think there's I think there's two next steps. One is directing them, guiding them towards healthcare services and products, but also beginning to guide them towards financial products that they need to ensure their health. For example, in India, 63% of the population does not have insurance, and we're seeing some really stark data showing that there's a high level of non-communicable diseases with people even in their 30s, right? So how do you help them not just get access to healthcare products and services, but also financial products that allow them to maintain their health resilience? That's one piece. The other piece is on the other side. How do you help product and service providers to understand the evolving needs of these populations? For example, we talk to consumers on a daily basis. We have our fingers in the pulse of consumer behavior and consumer health spending. How can we help supply side partners design new products and services that are tailored for the changing needs of these consumers, right? So I think it's equally important to do both because healthcare is a very uh, delivery local delivery subject, and it's very important for innovators to keep their finger on the pulse of changing consumer trends and changing consumer expectations. So those are the two next steps for us, and we're already beginning to move in those directions.
A question about kind of what happened in the run up to Saath Health. Were you involved in other startups, and how did these shape what you did?
So Saath Health is our third company. Our first company was a consulting company where we actually got to learn a lot. So I talked about some of the work that I did in the past on different digital platforms for HIV patients and working with large public-private partnerships for maternal and child health. That was part of the first company. Our second company, which we exited after 3.5 years, was trying to build platforms for doctors to be able to deliver better care for their patients. Uh, we exited that because we wanted to focus more on the consumer side. That's what really excites us. I mean, both of these experiences were extremely good for us to understand and learn what needs to be done, what doesn't need to be done. And I think they made us richer in terms of the learning that we brought to South Health.
So, a lot led up to the founding of Saath Health. I saw that you've completed a strategic leadership program at the Harvard Business School, and your co founder, Aditi Ganju, has also got a background in biochemistry and clinical research. What skills did you need before you started this company?
So Aditi is also my partner and my wife. So we worked together for many years, and I can talk about the different skills that we've had to acquire over the years. But I think the main skill, I don't know if it's a skill, but it's just a mindset, is one of being able to deal with uncertainty, right? And as doctors, there are many streams of medicine that train you to deal with uncertainty. I mean, I have surgeon friends who don't know, who tell me that every surgery is slightly different, and that I have physician friends who treat every patient the same. So I think just this ability to deal with uncertainty, not knowing where your path is leading, but being willing to explore and adapt is an attitude and a mindset that is, I think, extremely important, not just for entrepreneurship, but I would say it's important for anybody for the next 20 to 30 years because there's a lot more uncertainty. Jobs are not the same. Every job that people are doing is different. There's so much changing in terms of technology. And I just think that this, I mean, one thing that I would say to anybody listening to this, that the way, if you're a medical student today, the way you're going to practice medicine in 20 years is going to be dramatically different from the way you do it today. So just don't ossify yourself in practices. I mean, obviously some things are cast in stone, but otherwise just have the mindset to be open and explore, which is extremely important. Beyond that, I think just in terms of skills, uh, uh, I think uh, the work that I did with my previous organizations really helped me just understanding business, being able to read finances of a company, uh, just teamwork, collaboration, strategic thinking, making plans and then breaking them down into building blocks. I think some of those things are important skills that you learn along the way. Uh, Teamwork and collaboration is very important. There's a lot of doctors who, a lot of my friends, I shouldn't say a lot of doctors, a lot of my friends, doctor friends who are great working in as individuals. And if you're working on a larger canvas, you just can't work as an individual contributor. You have to be part of a team. Sometimes you lead the team, sometimes you are servant to other leaders who are involved. So I think just being able to understand that this is the teamwork that's really important. I think that's an important skill set to acquire.
So, a big theme you've mentioned is uncertainty, teamwork, and collaboration. And these sort of gave you the skills you needed to found this business and also have some background in those areas. Would you say you and your co founder have complementary skills?
Yeah, I think so. I think we've complemented each other in many ways. Aditi is great at very quickly grasping what a situation demands and making changes as required to it. Uh, I'm reasonably good at understanding where the world is going and how we must adapt to fit into it. But I think uh, having complementary skills in the team is really important, but even more important, and this is probably true in a surgical suite as well, is being mission aligned, right? There is no point having complementary skills if two individuals want different things out of what they are doing. And so I think the one thing that has really served us extremely well, we are married to each other, but we've also managed to make a go at three companies and we're still working together. I think one of the things that really helps is to be mission aligned. And we're very focused on making a difference, making an impact, and to do so in a sustainable fashion. Uh, and not having that alignment of mission and purpose could really set team members at cross paths with each other. So I think complementary skills important, mission alignment even more so. Yeah.
Now, moving on to your book. Your book talks about the inadequate supply of healthcare professionals. Its provocative title, A Glass Half Full, Stirring Healthcare Conversations for a Better Future, has prompted a lot of discussion around the challenges we'll face in the coming decades. Just for our listeners, a couple of statistics. The WHO estimates a projected shortfall in around 10 million health workers by 2030. And over 40% of WHO member states report to have less than 10 medical doctors per 10,000 members of the population. What prompted you to write this book, and what are the key take-home messages for our listeners?
Yeah. So I've talked to a lot of friends, healthcare entrepreneurs, and there's a lot of work happening in healthcare, but I think the main purpose of the book is to really exhort everybody to step back a few steps and look at the big picture of what's going on. And where I said this is the big picture, and irrespective of which part of the world you are in, there are four notable facts that are influencing healthcare. One is that we have a limited supply of healthcare workers everywhere in the world. The statistics are out there. I think there are 40 to 60 million nurses short, thousands of doctors short. And it's the same wherever you go in the world, right? So supply is extremely limited. And we are not even counting supply for things that are beginning to emerge as new problems. For example, the epidemic of mental health, the epidemic of geriatric disorders like dementia. We're not even accounting for the supply that we need for these new conditions, these so-called new conditions. So supply is limited. Consumer demand is booming because people are living longer. They expect to live healthily, obviously. They are more aware. There are conditions for which my mother would not have consulted a doctor 20 years back, and now she very readily goes and consults doctors, right? So demand is going up. We are all more educated, more informed, and hence we will seek more healthcare. And this is not changing in the next 20 years in any part of the world. And typically, whenever demand outstrips supply, uh, the cost of a service goes up, which is what's happening. There's huge medical inflation. I can cite you numbers for India, but we'll see the same in the US and Western Europe and many countries around the world. The cost of delivering healthcare is significantly more than the cost. We're paying more for healthcare now than we were paying for healthcare 5 years, 10 years back, and those costs are going to continue to rise. And my point of this book is to get everybody to say that we have to think about completely alternative new ways of delivering healthcare. It's not going to happen tomorrow. It's not going to happen in the next 5 years. But can we start laying the tracks for what a reimagined healthcare system could look like in the next 20, 30 years time, right? And it's still going to be within the lifetime where I might end up using healthcare. Certainly for our children, I think we need to start imagining what a new healthcare system looks like. And there, the direction for me comes from the fourth point that I make, which is the massive consumer adoption of healthcare. I mean, you use the word paternalistic. I agree. I think we need to start thinking about consumers as partners in healthcare. And how can we start task shifting some of the healthcare prevention work to consumers and get them to stay healthier, right? So the first 3 points that I talk about, limited supply, increasing demand, high costs, it's just a huge red flag for us to start thinking about how do we want to reimagine the healthcare system for our children. And the fourth point is really the positive note, which is huge consumer education adoption and technology usage. And that provides us a direction in which we need to start imagining how healthcare in the future should be delivered. I don't offer too many solutions. I have some sense of the direction in which we are going because I don't have any solutions. I don't pretend to. But I do think that it's important to start the conversation and certainly, I mean, if we are getting out to students, fourth year medical students, you guys are going to build the healthcare system for our future and for your future. And I think it's really important that we start thinking about different ways of delivering healthcare in the future.
Reflecting back on your journey, is there anything else you would have done differently?
I don't think I would have done anything differently, but I must say that I'm very envious. There is quite a few medical students I know now. There was an intern who worked with us a few years back from John Hopkins, and he's now studying medicine at Yale. And I've met quite a few other medical students who are getting exposed to multiple disciplines very early in their careers, right? So this person who's studying medicine now, he studied math, computer sciences, liberal arts. I know there's a lot of doctors who are studying data sciences very early in their careers. And I think that is absolutely fascinating. And I think that there is much of what is needed. We need to build specialist doctors who also have an understanding of other disciplines so that they can start thinking of medical science in interdisciplinary terms. I did not have that at all. I don't think it was standard for us to have multidisciplinary thinking in the training of medicine when I was in school. I don't think it was common in the West also. But I think this new trend of interdisciplinary thinking with medical students relatively early in their careers is very promising. Um, and I think it's just what's needed. So I'm very, very excited about this new trend. And I hope more schools do that.
Yeah, I think I'd agree with that. I think for me, I started thinking about medical school at the age of 16 and then started medical school at 18. And at times it can feel like we're sort of on this conveyor belt to becoming specialists in a particular field. And there doesn't seem to be a lot of scope to do more. But I think one thing that I've learned from high med is that there always is, and there are so many doctors doing interesting things outside of the clinical field. And one thing I'm grateful for is the opportunity to explore these other subjects as we have an intercalated year. Many medical schools do this, but it's a great opportunity to pick another subject. For example, some medics choose engineering, some people choose law, others choose philosophy, and it's a great opportunity to have all these cross fertilizations of ideas. And I think it's probably something that brings innovation, and I think that's good advice, and I think a great place to round up our discussion today. But before we end, for those interested in going into healthcare solutions like yourself, do you have any advice or recommendations for these listeners?
Well, there's a lot of exciting stuff happening in technology. So I think just starting to read the literature, starting to orient yourself with what's happening in technology is extremely important. Digital is just a tool. Uh, So I don't want to overstate the importance of digital. At the end of the day, you still have to deliver healthcare. And digital is a tool, much like a stethoscope or an ultrasound machine, but it can be a very, very effective tool to make an impact and scale. So, so I think this, orienting yourself with all the rapidly changing technologies is a very, very important part of preparing yourself to have an impact and scale. Tech, Technology is exciting because it can allow you to do what you're doing at massive scale. Right? That's that's why I'm in digital health, and so uh, just making sure that you have your finger in the pulse of the rapid changes in technology is really going to be very important.
And one final thing, apart from your book to stimulate discussion, do you have any recommended reading?
Big fan of reading things that are not in your area of focus. And I thought a little bit about this question. I think there are two books that come to mind that left a profound impression on me for entirely different reasons. One is a very old book, almost a 100-year-old book. It's an English novel called The Citadel. It was made into a movie in English. It was made into a Bollywood movie in the 1960s. And if readers haven't read it, I think they should. It's a very nicely written book. It chronicles the story of a very idealistic doctor who uh, whose path goes slightly awry. And I think the book is really important because many of the conflicts that doctors face today were have been outlined beautifully in this book. Uh, Way back in 1937. So, and it's striking to me that doctors even today have to write through the same conflicts. So I think it's a great book to remind yourself of the purpose of why you're becoming a doctor and to keep you on track and to remind you that staying on track is not easy, but it is something you need to do. And the second book that again has a profound influence, which is completely nothing to do with medicine, but I talked a lot about the ability to explore and be open to uncertainty is a book that chronicles the first conquest of an 8,000-meter mountain. It's a climb of one of the Himalayan peaks called Annapurna by a French mountaineer called Maurice Herzog in 1953. And the reason I think this book is very interesting is because uh, Maurice very nicely puts you in the head of somebody who's exploring a journey that has never been taken by anybody. Nobody knew the paths to get to this mountain peak. There were no roads. There were no established protocols. And just the way he enjoys the journey and goes about finding those paths, I think is a metaphor for many of us as we live our lives. And not to be daunted by uncertainty, but to celebrate and enjoy the uncertainty and keep walking through it to find your path. So for me, it's very metaphorical if you're trying to find paths in life. So both of these books are great books. They may completely not work for any of you, and you might wonder why I'm suggesting any of these, but I found them profound influences in my journey.
So, on that note, thank you, Dr. Aakash Ganju, for your time today. We've learnt a lot about digital healthcare solutions and your career path.